I'm joined by Dr. Tony O'Sullivan, who's the co-chair of Keep Our NHS Public campaign. He's also a retired NHS paediatrician. Great to have you with us, Dr. O'Sullivan. Thank you very much. I just wondered, from your sort of colleagues who are still in the health service, your background having been in it, how concerned are you by this potential impact on A&E?
I'm very worried about the whole system, and that includes what GPs are struggling with, what A&Es are struggling with, and the hospital inpatient service, and indeed social care. So right across the system, as a paediatrician, I used to work with disabled children and their families, and we really needed a whole system to make the thing work. You know, social care, education itself, GPs, A&E, hospital specialties. And when that whole system isn't working together, then it all begins to break down. And at the moment, the whole system is under pressure. And I know people push back on this, but it's been the NHS has been severely underfunded compared to need for the last 14 years. And we are now seeing the wheels coming off. We're seeing A&E at boiling point and 250 patients dying avoidably every single week because of the delays there. GPs are working so much harder than they ever have done before. We're talking about extra patients over the last 2 months in A&E. GPs would see over 50 million patients in 2 months, and they are now seeing nearly 300 patients on their lists, more than they would have done in 2018, that they're responsible for. 1 in 4 GPs know a colleague who's actually taken their own life. And more GPs are forced into self-preservation by reducing their hours to go part-time, even though a lot of they're still working overtime to do their paperwork and so on, or retiring early. So this is a really serious issue, and one thing we mustn't do is to say one part of the system is taking action at the disadvantage of another system and take sides, if you like. We need a whole system review.
Well, and I do concur with a lot of what you said, but in terms of the immediacy, and look, Stephen Powis issuing this warning, and we're led to believe that these are the 3 busiest months in history at A&E. I mean, there will be plenty of people listening to this desperately worried and wondering, totally take your point about funding, but in the short term, what exactly can we do? Because people who are, I imagine, going to be turning up at A&E are doing so because they can't get their GP appointments.
Yeah, well, this is a dispute that's a genuine grievance from the body of GPs, and therefore it needs urgent negotiation by Wes Streeting and the Labour government. They're coming in. I know they're only 5 weeks into power, but the GP system has been so badly damaged by previous policy. The 1,700 fewer GPs than in 2015. So I don't want to throw statistics at you, but Wes Streeting has already made one concession to the GPs to increase the uplift promised by the Conservatives, which was less than inflation of 1.9% up to 6% for the GP overall contract. That's as I understand it. And they've also changed the ludicrous position that the Conservatives had, where they provided extra funding for primary care, but they didn't allow GPs to fill locum vacancies with that money. It was only to be for physician associates or nursing associates, i.e. replacement roles for GPs, whereas in fact physician associates and nursing associates are supposed to be supporting primary care or hospital practice, not taking the place of trained clinicians. So the one thing that would solve this is further urgent negotiations by the government and say, we recognise that even 6% is more than 1.9%, but it's simply not enough because GPs are either taking their own lives or coming out of the system. So they need urgent relief from this. And that would solve the problem within a few days, and this action would end. And of course, it's not strike action. It's taking measured action to try to preserve their sanity and to make the workload equivalent to, for example, Italy, where there are far more GPs per head of the population.
But what I would put to you is, I agree that clearly there are legitimate concerns that GPs have, and those stats you were suggesting about people who know someone who's taken their own life is absolutely shocking. I agree. And you hear stories all the time about NHS GPs struggling to keep the lights on. They can't afford to keep staff on. But at a time when, to give Wes Streeting his credit, we've given a new offer to junior doctors, which they're currently voting on as to whether to accept it. Why now? Is there not a question about timing? Because we've seen almost a barrage of pressure on the NHS from nurses who've now reached a settlement, from junior doctors who are in the process of. Is there not a sense that this could have waited?
Well, there's 2 points to this. One is that industrial action taken by a staff group in any industry, but also in the health service, requires a whole process months in advance to be able to legitimately go forward and take action if negotiations have broken down. And the GP body didn't know that there was going to be an election on the 4th of July. So they planned this, and they had their ballots and so on, and that's taken place. And the second point is that the immediacy of the crisis is such that they have to, they feel, I mean, I'm not a GP, I'm just reporting what I have read and understand, but they feel they cannot afford for negotiations to go off into the future and for no urgent action taking place when there are actually GP practices closing down every single week. And there are a couple of hundred GP practices that have closed down over the last few years. And this is truly a crisis. In NHS dentistry, over 50% of children can't even get an NHS dentist. And it's now the result of that is it's the single largest number of hospital admissions for an anaesthetic for dental extractions of children. If we reach the situation where people can't get their GP, they can't even find a GP to register, let alone get an appointment in time, we are facing a true crisis on top of the immediate crisis of 250 people a week dying because of A&E delays, thousands of people dying avoidably because of delays in access to specialties in hospital.
Thank you very much for your time. Much appreciated. Dr. Tony O'Sullivan, who's the co-chair of Keep Our NHS Public, the campaign, who's also a retired NHS paediatrician.